Warning signs of gallbladder in danger. You finish a meal and suddenly you feel heavy, bloated, maybe even a strange ache under your ribs or in your back. You ignore it. Maybe it's gas, maybe stress. But what if I told you your body is being quietly warning you and you've just been too busy to notice? It's your gallbladder, and when it's in trouble, it doesn't always shout, it whispers, in a small, annoying, but easy to ignore ways, until suddenly you're in an ER talking to a surgeon. In this video, I will talk about the early warning signs, the real risks, the worst foods for gallbladder health, and most importantly, what you can do starting today to help your body heal. Let's get into it. What even is the gallbladder? It's a small pear-shaped organ that sits right underneath your liver. Its main job? It stores and releases bile, a fluid your liver makes to help break down fats. So every time you eat something greasy like burgers, cheese, creamy sauces, your gallbladder squeezes bile into your small intestine. It's part of digestion, but if the gallbladder misfires, or bile thickens or gets blocked, everything starts to back up. That's when the trouble begins. And the tricky part? These problems are very easy to confuse with other issues like indigestion, reflux, even food poisoning. Here are the top signs to look for, especially if they show up after a fatty meal. 1. Pain in the upper right abdomen. That tight, crampy ache under your right rib cage, classic gallbladder pain. It can feel like pressure, fullness, or even stabbing, and it often shows up 30 to 60 minutes after eating. If it lasts more than half an hour, 1 hour, you should consult with a doctor immediately. 2. Pain in the right shoulder or between shoulder blades. Strange, right? But gallbladder pain is often referred to the back. You might feel a dull ache between your shoulder blades or in your right shoulder, especially after meals. 3. Nausea or vomiting after eating. Fatty meals make you feel sick to your stomach. That could be your body struggling to process fats without the right bile flow. 4. Indigestion, burping, bloating, maybe even reflux, and it's getting worse after meals. That's a red flag, especially if it's happening regularly. Now, those are the early signs, but if this keeps progressing, here's what might come next. 5. Yellowing of eyes or skin. That's called jaundice. That's the bile backing up into your system, and it's serious. Time to visit your doctor. 6. Dark urine and pale stool? Yeah, we are talking about your pee and poop. Dark brown pee almost like coke, chalky or pale stools? That's bile not reaching your digestive system, which happens when the ducts are blocked. 7. Fever or chills after eating. This can mean the gallbladder is inflamed or infected. That's ER territory, do not wait. Worst food for the gallbladder. So let's talk about what to avoid if your gallbladder is struggling. Fried, greasy or fast foods. Heavy dairy like cheese, cream or whole milk. Refined carbs like white bread, pasta and pastries. Sugary snacks and soda. Now, it's not about demonizing fats, it's about understanding how our body works. Every time we eat fat, the gallbladder is squeezed to deliver bile into the digestive tract. This is true both for good and bad fats. And this is actually a positive thing, as it prevents the bile to remain stuck inside the gallbladder, creating stones. Now, if you are already having stones and symptoms, every time you squeeze the gallbladder, the pain and the symptoms can come back. So it's not that all fat is bad. You just want the right fats in the right amounts. Now let's move from problems to solutions. What can you do in the first place to avoid the formation of stones in the gallbladder? Keep a healthy and diverse diet, including healthy oils in a moderate quantity. Maintain a healthy and stable weight. Fast loss of weight is a major cause of gallstone formation. Routine physical activity is always positive. Magnesium and vitamin C. Magnesium can improve the gallbladder emptying, and vitamin C helps converting the cholesterol into bile acids, reducing the gallstone risk. Eat smaller quantities more frequently. Stay very well hydrated and manage stress, as cortisol affects bile secretion too. Now, if you are the kind of passionate about natural remedies, there are a bunch of poorly proved recipes in the web, including mixing cider vinegar with lemon water, dandelion root tea, milk thistle, or peppermint tea. As a doctor, I can only tell you there is not enough evidence to establish a general recommendation, but if used in a wise way, it's unlikely they will be harmful. Unfortunately, there are still some risk factors that we cannot modify, like being female hormones increase the bile density, especially during pregnancy, and some genetic factors too. Look, your gallbladder might be small, but it plays a big role. Yes, you can survive without it, But we all like to stay away from the operative room, right? So if your body is giving you signs, listen now. Use food as a prevention, use nature as a support, and if needed, yes, seek medical help. But don't let the first step be removal, especially if you have no symptoms at all. If you find this video interesting or helped you in any way, pass it to someone else who's struggling. You can help. You can save your gallbladder. You just need the right tools and someone to walk you through it. I'm Dr. Daniel Serralta, and I'll see you in the next one. Thanks for watching.